Imagine failing a clinical nursing course. You now must wait weeks or months before you can try again. You no longer have access to course materials or faculty support, yet you're expected to return to clinical practice better prepared than before. That is the educational gap that inspired the Clinical Bridging Program. Engage, empower, excel. Each student begins with an individualized learning plan created collaboratively with a course leader. This makes the remediation for each student targeted and meaningful rather than one-size-fits-all. Students then complete learning activities designed to strengthen the clinical competencies they are struggling with, as identified in their learning plan. For example, in this module, students use a fictional patient chart to organize assessment findings and develop a plan of care. Interactive knowledge checks require students to apply clinical judgment and prioritize care while receiving immediate formative feedback. To follow the student is asked to give report to an AI-supported buddy nurse, allowing them to practice communication and receive feedback in a psychologically safe environment before returning to the clinical setting. There are 10 different modules, each focusing on various competencies such as communication, assessment, medication safety, and documentation. Virtual simulations immerse students in authentic clinical scenarios where they apply clinical judgment, prioritize care, and communicate with the interprofessional healthcare team. As students progress through the program, they add the embedded feedback they receive to a portfolio. This allows instructors to review learner progress without the burden of grading. Because the program is built around the core competencies that are universal to nursing practice, it can be readily adapted to nursing programs locally, nationally, and internationally. Beyond nursing, the instructional framework could also support competency-based remediation in other allied health professions, such as medicine or pharmacy. Simply put, the Clinical Bridging Program, Engage, Empower, Excel, prepares students to return to clinical practice with greater confidence and competence to practice their chosen profession.